My name is Dr. Isiah Dhliwayo, doing Bachelor of Science in Psychology and Counseling, nationality Zimbabwean. My academic session was from 2022 to 2025. In my first slide, I'm going to address the issue of loss and grief as an interprofessional exploration of the integrated process model. And in this slide, which is my slide number 1, I also indicated the student name, which is my name, and I also highlighted the program that I am doing, which is Bachelor of Science degree in Psychology and Counseling, and today's date is the 5th of November 2025. Good morning, distinguished panel members and colleagues. My name is Isiah Dhliwayo, a final year student of the Bachelor of Science in Psychology and Counseling. I'm really honored to present my research entitled Loss and Grief, an Interprofessional Exploration of the Integrated Process Model, which investigates the multidimensional impacts of loss through the lens of the Integrated Process Model, IP. Despite extensive literature, traditional grief models often fragment the experience into isolated stages. My study adopts a mixed methods approach, engaging professionals from psychology, counseling, nursing, and social work to explore how the IPM's 5 dimensions, which are physical, emotional, cognitive, social, and spiritual, how they interact in the real world setting. On slide number 3, I looked at the background and the rationale. Why does it matter, or why it matters to choose this topic of loss and grief? And I realized that loss and grief are universal, yet often compartmentalized, limiting a holistic care. And in order to do this, there is this gap which I'm trying to fill, the research gap. Traditional stage models, e.g. the one by Kubler-Ross, it fails to capture the dynamic, non-linear nature of grief. And as a result, there is an advantage of IPM, which is that of integrating physical, emotional, cognitive, social, and spiritual dimensions, aligning with the contemporary calls for interprofessional. With my defense, on slide number 4, I have some research questions which this thesis seeks to address. And number 1 are the emotional, psychological, and social impacts of loss on individuals. Number 2, I look on how do individuals experience and make sense of loss and grief. The third point is about what coping mechanisms and support strategies that are effective in managing. On slide number 5, here are the objectives of this thesis defense. Number 1, we'll explore the lived experiences of grief and the emotional, psychological, and social impacts of loss. And I identify effective coping mechanisms and support strategies which therefore contribute to the development of evidence-based grief interventions. Moving on slide number 6, there is the hypothesis, and in this area, I will look at the significant loss which correlates with a heightened anxiety and depression. Number 2, on the problem, focused coping and strong social support which improve mental health outcomes. And number 3, I'll look at the robust support system which reduce prolonged grief symptoms. Moving on to slide number 7, there is an overview of the literature review. Here there's the evolution of grief research from early bereavement studies to contemporary broader explorations according to Rumbold et al. In 2021 and Walter 2008 and 2020. There's also dominant models which were highlighted by Kubler-Ross of 1969, which seeks to address this traditional stage or phases of theory about the dominant models, and the jaw process highlighted by Straub and Stewart in 1999, which focuses on psychological factors which neglecting the interdisciplinary dimensions as indicated by Class et al. In 2014. There's also a gap which I identified which seeks to be addressed by this research. And this gap identified is the limited integration of social, cultural, and spiritual variables, few frameworks which bridge the multiple professional lenses, as evidenced by the citations of Rambold et al. In 2021. Here we look at slide number 8 about the theoretical framework, the IPM, Integrated Process Model, which synthesizes number 1, emotional. On emotional, there's the aspect of grief reactions, anxiety, depressions, all which fall under the emotional aspect. On the cognitive aspect, we have the meaning and the making appraisal. And on social, we have the support systems, relational dynamics. On spiritual, we look at the existential sense making. Dual process oscillation, we look at the individual's move between loss-oriented and restoration-oriented coping, according to Straub, 1999. The interprofessional relevance, IPM, invites collaborations across psychology, counseling, nursing, social work, and spirituality. On slide number 9, I'll look at the key studies supporting IPM. And on this, we have the key finding relevance to IPM. And I quote Straub and Stewart, 1999. The jaw process model, which highlights grief, which involves oscillation, supports IPMs, and in terms of the dynamic coping, and validates nonlinear and multidimensional coping. Pregeston et al., 2009. There is also prolonged grief disorder distinct syndrome, which needs for precise assessment tools and highlights the psychological dimensions in IPM. Neymar in 2015. We also have meaning-making narrative reconstructions, which improves outcomes and aligns with cognitive spiritual components of IPM. Rambold et al., 2021. Interdisciplinary grief care, better outcomes when multiple professions collaborate, and direct supports of interprofessional aspect of IPM. In order to do the research, there are methodologies, which is on slide number 10, and on this case, on study design, of mixed methods, sequential explanatory, quantitative phase, online survey, then qualitative phase with same structured interviews, instruments, integrated grief questionnaire and analysis, then quantitative, have descriptive, correlation, regression, and thematic analysis. Then on slide 11, we have the results whereby we look at the qualitative themes. And here we are looking at the oscillating coping and spiritual reorientation, which calls for need for interdisciplinary. Furthermore, I will discuss on slide 12, this is the discussion part where I highlight that IPM alignment, we have participants who experience grief across all 5 IPM dimensions, thereby confirming the model's multidimensional utility. We also have interprofessional synergy, where we highlighted collaboration, which emerged as a key facilitator, echoing what Rambold et al. In 2021 highlighted. And there's also contracts. And on contracts, while CBT and mindfulness showed promise, cultural indigenous practices were underutilized. On slide number 14, here we look at the limitations in future research. On limitations, we have small sample, we realize we have a small sample size. Then the context is specific setting, self-report bias, then cross-sectional design. And because of that, we also have our future research. Here we highlighted that number 1, culture exploration, whereby grief narratives across Zimbabwe, ethnic groups and migrant communities. They examine rituals like Kurova Guva and intervention efficacy of RCT testing, CBT, mindfulness and blended indigenous Western approaches. Number 3, longitudinal studies track grief trajectories over 12 months and beyond. Number 4, mixed methods have combined quantitative skills with ethnograph for deeper understanding. Ladies and gentlemen, colleagues and friends, allow me to do the conclusions, which is on slide 15. And as a summary, this study confirms the integrated process model as a robust framework for understanding grief's multidimensional nature, highlighting the value of interprofessional collaboration and cultural context. The contributions: it provides empirical support for IPM, offers actionable insights for clinicians, and identifies gaps for future research. Finally, the closing takeaway for this defense: by embracing both evidence-based interventions and cultural attuned practices, we can deliver more compassionate, effective grief care to diverse populations. Thank you for your attention and thank you for listening. God bless you.